I'm Colleen Dougherty. I'm a nurse practitioner at the German practice for the Wright Center, and I'm director of MPPA services. We would go to high-rises that had 70 to sometimes over 100 patients that we had to vaccinate for first and second vaccines. So we were on a quick schedule with that, and it seemed like they were doing multiple 3 to 4 a week at one point. We encountered a lot of patients that would think it was political, or just that COVID, the vaccine would cause COVID. So we had to encounter a lot of those things to overcome. So that was probably the most difficult. I have one particular patient that had COPD, diabetic. I actually see her pretty regularly, and I never thought she was going to be one that would definitely not want to get the vaccine, especially with her comorbidities. But when she came in and she was adamant, and I didn't want to see her end up in the hospital, because she did acquire COVID at one point in time where she was, but it still didn't click where she thought she was going to need the vaccine. But again, educating her, talking about that was a big thing. I listened to her and validated her concerns, and then basically she ended up getting her full series, her boosters and everything, so she's completely vaccinated to this date. I always try to educate my patients, so I would definitely go in and explain the benefits of the vaccine, the safety of the vaccine. Also, I would talk about just in general how we protect other immunocompromised patients, and most importantly each other. You would think now that we've been vaccinating for as long as we have that we haven't seen really big concerns with the vaccine and any kind of side effects or adverse reactions. So yeah, that's something I'm a little surprised about. Again, educating, building the trust with the patients is really important. I think to make sure that they're on board with stuff, and that's with anything. It's just but obviously vaccines are crucial.